Good afternoon, everyone. Tanya and Gail, thank you so much for inviting me to present at this amazing conference. I'm really grateful to them and to all of you for having me here. Currently, as you can see, I am the Associate Academic Program Director at the National Mass Violence Center, which is located at the Medical University of South Carolina. And prior to that time, I was the director of the New York State Office of Victim Services, and previously I was a special victims prosecutor. And I bring that up because it's relevant to some of the things that I've learned about victims, about how we work with victims, what we know about them, what we don't know about them, what we know about ourselves and not. And it's important when we're doing this work to sort of understand all those dynamics so we can figure out how to best serve people. For those of you who are on social media, a couple of months ago, there was a social media thing going on about if you were a woman and you were lost in the woods, would you rather run into a man or a bear? Does anyone remember that? So what did the women choose? The bear. Like 100% of the time, the women chose the bear. And, you know, men on social media went crazy about this is ridiculous. You know, how would a woman choose to run into a wild animal, and they're so unpredictable. And for women, our response was what? Duh, right? Because if you get mauled by a bear, you know the bear is doing what bears do. And what questions aren't being asked of you if you get hurt by a bear? What were you wearing? Had you been drinking? I mean, all of those questions that often come up for women who have been, and for men too, who have been sexually assaulted, those are not questions that would come up in that context. And I was trying to explain this to my husband I said, when you go for a walk in the park with the dog, I said, do you ever like really scope out your surroundings? Like, do you know, if somebody comes into the park that you don't know, you know, do you think about whether you're safe? And he said, no, never. And I said, well, I am every time. Every time I go in to go for a hike by myself, I'm thinking of those things. And so, you know, it's why we're here, because these things are happening and there are things that we have to address. I was really grateful to hear Dr. Corcoran's talk about how we have to respect people's boundaries. And having spent 14 years as a special victims prosecutor, I had to grow to understand that, because when you're in law enforcement, you know, you want to get answers, you want to get the bad people, and it took a lot of growth for me and my colleagues to understand how do we talk to people in a way that kind of enrolls them in what we're trying to do, that we're respectful of them and their ability to talk to us, and that sometimes my specialty was child abuse, and I worked with toddlers all the way up through teenagers, and you know, they're not easy to talk to on either end of that spectrum. And it could take months to have a child trust you to the extent that they would tell you anything. And so I learned a lot about working with victims and understanding the dynamics of, you know, how to work with them and to be in a space where they feel that they can trust you and that you respect them and what they've been going through. So that has nothing to do with what I'm here to talk about. But because of the history that I have working with victim services, I ended up coming to the National Mass Violence Center because in New York, we had experienced a number of mass casualty events. And for those of you who, I was here yesterday and did a couple of breakout sessions, so you've already been through this, I apologize. But, you know, we all know that this is something that happens in any community. I won't say every, because it hasn't happened in every community, but it could. And a lot of the communities that it's occurred in are places that, you know, one would think this is not going to happen in a little elementary school in a nice suburb in Connecticut, or in Parkland, Florida, or in a nightclub, or in a movie theater, or in a grocery store. That anywhere that people gather, these kinds of events can happen. And thousands of people are injured or killed as a result of these events. And of course, mass violence events sort of take on a bigger role in the press than the number of incidents that there are. It's sort of, when there's a big plane crash or something, it gets a lot more attention than a commuter plane or something like that. But what happens is that mass violence events are they're a different kind of animal. And it's true in any community, but particularly where communities have been underserved and under stress for a long period of time. And those communities where they have experienced a lot of violence, it can really exacerbate the situation. So what we have seen in the research, and the organization that I work for is a research institution. It's one of the reasons that they were able to get this federal grant to do this work. So they look at what the trends are, what the data is, and there is a clear intersection between mass violence, mass shootings, and domestic violence. In fact, more than half of mass shootings are of family members and intimate partner violence. Now, when we heard the story about Esther, I mean, that was brought home to us so clearly about so many people who suffer at the hands of a person who purports to love them. And what we find is that mass shooters often have a history of domestic violence. 68% of mass shooters either killed family members or they have a history of domestic violence. Those are pretty stark statistics. And some of the organizations that do intensive research on and advocacy in gun violence, so Everytown for Gun Safety, has stated that there's a profound connection between interpersonal violence and mass shootings. And domestic violence has been part of most mass shootings. So they might not be the shootings that we normally think of as mass shootings, the school shootings and those kinds of things, but often they involve multiple family and friends. And some of the examples where these were shootings out in public, Sandy Hook, there was a domestic violence underlying, Uvalde, Pulse, Sutherland Springs, and even as far back in 1966, which was one of the first mass shootings that really got a lot of publicity, was at the University of Texas at Austin, where there was a terrible mass shooting, and there was a domestic violence situation of that shooter as well. And according to Giffords Law Center, which was started by the former Congresswoman from Arizona, who was herself seriously injured in a mass shooting, she started this law center. So American Indian and Alaskan Native communities, the incidence of gun homicides are a little over 2% higher than in non-Hispanic white populations. But in this state, they're 8.5 times higher. And often these shootings are related to domestic violence. Now, why do I bring up that statistic? So it has relevance in a couple of different ways. One is, if there is a high level of gun violence in a community, then it means that community is already traumatized. And so the exacerbation of that trauma will happen if there is a shooting that is of some magnitude. The other thing is that sometimes in communities that have high levels of gun violence, there are more resources available because the community has made a decision as a result of that to organize, to provide victim assistance programs, that sort of thing, credible messenger type violence interrupter programs, but not necessarily. So just very briefly, our center was started because the Medical University of South Carolina started something in the 1970s called the National Center for Victim Research and Treatment Center. And they were a well-known organization throughout the country where PhD-level clinical psychologists do all kinds of research into victimization, and they also have a whole treatment program there. But they never got involved in the mass violence space. But when the Mother Emanuel shooting happened in Charleston a few years ago, they were called on to respond to this event. And they realized that they were really not prepared. So even though they were trauma therapists, trauma clinicians, and researchers, they were really not prepared to respond to something that was as overwhelming for the community as this event was. And so they were funded by the Office of Victims of Crime, which is in the Department of Justice, initially to provide funding for the Mother Emanuel shooting. And it gave the organization a lot of information about what needed to happen with responding to mass violence. So, I mean, a lot of this is just sort of basic about, we're looking to do evidence-based research, evidence-based practices, very trauma-focused and research-based. So in 2017, we got a cooperative agreement with the Office of Victims of Crime to do some work with communities that have been impacted by mass violence, such as providing information and giving the communities the research and sort of just being not an advocate, but being an option for information and for resources. And but what they realized was that it wasn't enough, that for communities that are impacted, and it is a profound impact, that they needed something else besides just information and lists of resources and research. They really needed somebody to go out and respond directly to these communities and do everything through a victim-focused lens. So everything that would be happening in that communication with those communities would be working with them on how to identify resources that are there, to do a needs assessment to find out what they don't have and what they need. And one of the examples I used with the groups yesterday was that in Lewiston, Maine, that had that terrible shooting in October, one of the victims there who had been there and had been injured got a therapist that was suggested to her, and she said, this therapist is a wonderful person, but they are not trauma trained. And so they're not really able to help me. And it was very frustrating to her. And it was something for the community to learn about, yeah, we had therapists, but they weren't the right therapists. And my former agency, we responded to the Buffalo Top shooting in May of 2022, which was a white supremacist targeting a black community in their grocery store. And what we learned there was that they didn't have a good store of black and people of color to come in as therapists for that community. And my agency had funded a lot of programs in the city of Buffalo, but none in that neighborhood, and none that had a significant number of therapists of color. And so had we thought it through about what might happen in a situation like this, we might have been able to handle it differently and the community wouldn't suffer. And really the whole reason I'm here is to talk about preparing to deal with mass violence. So in addition to our staff now being able to go out into these communities that have been impacted by mass violence, they added a preparation division, which is when I got hired. And so what we're doing is we are going to communities that invite us in to give them information and support as to how to plan to deal with a mass violence event. And it can be overwhelming. I think a lot of us that work in the system in some capacity have no idea what our state, what our city, what our county, what our reservation, whatever our community is, has planned, has organized to deal with something like this happening. And in my experience, and I have responded to a lot of mass violence events, is you don't want to be responding to something that you have not thought about ahead of time, because on its best day, a mass violence event will be complete chaos, and on its worst day, it will be unworkable, and you will have a community that is doubly traumatized by what's happening to them and the fact that nobody kind of thought through how we were going to deal with this. So we are called the National Mass Violence Center, but improving community preparedness and training and technical assistance. So what we offer are technical assistance to communities that invite us in. We will work with you to identify partners that you may want to consider in the work that you're doing. We will help you write a plan if that's what you want. We'll review a plan if you already have it. We'll take you from 0 to 60 if that's what you're looking for. Whatever the needs of the community are, and some we're working with communities that want us there to go through the whole thing with them. Others, we work with universities and their public safety teams. We work with individual school districts, with cities, whoever needs us to come in. We have all kinds of, I'm just providing these slides for information, but we have all kinds of guidelines and best practices and things to help you through your planning process and then your response and recovery process. There is so much to think about with a mass violence event. And I shared yesterday that my office, we thought we were prepared. We had go kits. We bought all these suitcases, and they were filled with stuff. And we get to Buffalo, for example, and realize, we have all these suitcases, and we have one table runner for all these tables we're setting up. We didn't have enough. We didn't have access to Wi-Fi, so we couldn't do our laptops, and we didn't have anything that we could use to connect to the internet. We usually respond to something and there's someone in charge. Nobody was in charge. It was just terrible chaos, and we really thought that we had planned. But really what you need to do is start from the bottom up and identify who do you want to work with. And what we always stress is that every response to a mass violence event, or to a mass casualty event, whether it's an accident or it's human caused or it's a mass violence event, everything is local. The response should come up from the local responders, local community. We're not there to tell people what to do. We're there to augment what you already have or to help you identify what you need. We'll do all of these things. That's one of the reasons that Gail invited me here, was to talk about, these things that we don't like to think about. So many communities do not want to consider that this is something that could happen. But if you see a lot of domestic and sexual violence in your community, then you're one of those communities that could be at risk for experiencing something like this. And it is hard to think about, and it's hard to wrap our heads around that somebody, whether it's someone that comes in from the outside or somebody within our own community, would commit something like this. The guy in Lewiston, Maine, he was part of that community. And that was not somebody that you would expect necessarily would come in. But, you have, and Sandy Hook, the guy who committed the acts in the Sandy Hook shooting, he went to that school. They lived in that community. But there's also when a place is targeted by a shooter because of who the people are, it really creates a whole different dynamic about feelings of safety and security. And when in Buffalo, East Buffalo was targeted by a white supremacist because most of the people that lived in this community were African American and black. And so every person that lived or worked or had connection with that community suffered terribly as a result of that event because they knew that they were being targeted because of who and what they were. And so that creates a whole different set of trauma dynamics that you have to think through when you are thinking about a plan for dealing with mass violence. So we also have a lot of consultants. We have partner organizations that we work with to help us sort of work with particular communities because they are either part of that community or they've been there. And so it's not just us who are trying to figure out ways to be supportive of you. You know, we have a lot of real subject matter experts. These are some of the partners that we work with. Like IAEM is the International Association of Emergency Managers. You have to work with your emergency managers. You have to look at who is in sort of what role they're going to play in a mass violence event, and how they're going to incorporate victim services. And that is the number one thing that we stress. And even when I was in my former role with New York State, I would communicate with all the county Office of Emergency Managers and say, you have to include your victim services into your plan. Because do you know like what a family and friends center is and how long it stays open, or a family assistance center or a resiliency center? How do I set it up? Who do I set it up for? Oh, she's got the card. So when I saw you coming, I knew that's what it was. She's like got the hook, You're... I know it's between me and lunch, so. But it's important to think through all of those things because you don't want to be running around when it happens. Because the other thing is, when a community is impacted, even the first responders and other folks, they're impacted too. And that's what we discovered in Buffalo, was the helpers were all traumatized. And so we're coming in and trying to organize and help set things up. And the people who were stepping forward and really doing the work were also incredibly traumatized. And it led to a lot of problems. And there's things that, I just wanted to share too. This is one of our partners. But the thing that you find when you're going through this is that, having all of these things in place will make for a more orderly and calm response rather than complete chaos, because people are already in chaos, and you want to do everything in your power to alleviate any stress or trauma on the people who have been exposed to it. And also, for example, in Buffalo, this happened, it was on a Saturday, but it was right around the corner from a school. And those kids didn't want to go to school. And we had older people who lived in the neighborhood who wouldn't come out of their houses. And we had a grocery store that was everything to this neighborhood. It wasn't just where you bought food, it's where you paid your bills, you got your cash, you bought your bus ticket, you met your neighbors. Every function went out of this supermarket. And so when the supermarket was unavailable, it was as if it had blown up. It was not there. And so you weren't talking about how to get people mental health counseling. You were talking about how to get people food and diapers and bus passes. And it was very, very basic needs that needed to be addressed. And that was also something that we didn't fully understand, but has to be considered. You have to think through a lot of these possibilities. So one of the things that has been developed through our office and others is best practices. And so if there's 16 of them, but we're always considering, what, if anything, needs to be changed. But these are the things that through experience has shown you need to have thought about and should plan for in a mass violence response. And my organization is available to help communities. So for example, we're working with the state of Hawaii, and as I shared yesterday, it's the one place they haven't let me go. I'm very sad about that, but hopefully someday I'll be able to go there. But they don't need all 16. They've already worked on some of them. So we worked with them to identify those where they feel they're lacking in information. And so we're working with them on developing a plan for that. So I will tell you that, setting up all this stuff is critically important, and it's important to know ahead of time, where are you going to have it? Who's going to run it? Who's going to pay for it? What are you going to have there? Who's going to be there? Who's going to keep people in or out? Is there going to be some kind of a sign-in system? Who's going to be responsible for that? Volunteers will come out of the woodwork, and they will be honest brokers, and there will be dishonest brokers. And there will be people who come because they truly want to help, but they're in the way. Or there are people that come because they're agitators and they want to create problems. I've seen it both ways many, many times. Who's going to manage the volunteers that do show up? What are you going to do with them? Financial donation management. Money will pour in from outside of the community, and it causes a lot of problems. You will have all kinds of money and other donations, and a lot of times they donate stuff that you absolutely don't need. But who's going to manage that money? How is it going to be distributed to people? What is the methodology that you're going to be used? And I will tell you, in every situation I've been involved with, that caused the most problems of anything that was dealt with. Is there going to be a memorial? When the 1-year commemoration time comes up, is there going to be a memorial? Who's going to be involved in that? What are you going to do? What are you going to do with all the stuff that was donated? Is it going to be kept and maintained? Who's going to maintain it? Where's it going to be? Are people going to have access to it? Who in your community can respond? Who's available to help? Your victim service organizations are likely not going to be able to handle the volume that may occur as a result of one of these incidents. And we're talking a lot of very long-term recovery. And, who's out there waiting up at bat to come in? Are they trauma trained? If they're not, how can you get people trauma trained? What organizations like the National Organization of Victim Advocacy, how can we utilize their services to get people trained in trauma response? What are you going to do for your first responders? What kind of resources do you have for them? And having been a prosecutor for many years, and this was somewhat in the dark ages in the late 80s and throughout the 90s, we did not take care of ourselves. And our way of dealing with the terrible stress of going to autopsies and seeing children battered and everything else was to go out and party a lot. There was a lot of alcohol abuse, a lot of marriages fell apart. People dealt with their trauma of being a responder, but not in a healthy way. We did not understand that that was even a thing. I think we know a lot more now, but there's still a lot of that bravado in the law enforcement community that I've got this, I've seen it all. But I have a brother-in-law that was a firefighter during 9/11, and he's still not okay. There's a lot that didn't get said about the trauma that first responders experience. We have, there's all kinds of grants that can be applied for. Who's going to apply for them? What are you going to do about your victim compensation? What if you have to bring in relatives from outside? You're going to have FBI victim advocates there. You may have NOVA advocates. You're going to have your own advocates. Who's going to be managing all of this? And what's your plan for going forward? You know, how are you going to deal with lessons learned? I will say I was impressed with Lewiston, Maine, because the governor and the attorney general's office immediately got a commission together, and they started holding hearings about, it was mostly on the prevention side of looking at how could we have avoided this guy, because there were like many red flags and multiple signs that this guy was not going to, where he was going to decompensate. But how do you plan for that? And you're going to go through a trial. You know, we learned all about what happened with Esther. Trials are very, very, very difficult for victims to go through, as many of you know. What support are you going to have for those victims? How is that going to work? What's the long-term support going to be? How are you going to continue training? Once you develop a plan, it's automatically stale. You have to keep planning, keep training, keep understanding your community and differences that you may have to respond to. So this is our website. We have a ton of resources available. We've got tip sheets and town halls and podcasts and all kinds of information that may be useful. But you can request to work with us, and we can provide you with information, and then you can talk with us and make a decision about whether that works for you. The beauty of this is it's completely free. We will come to you and we will provide you the level of support that you say that you need. You know, we're using our experience, and many of us, most of us, have responded to multiple mass violence events and have a wealth of experience and knowledge about what has worked and what hasn't worked. I mean, I convened a summit of several states when I was at New York State OVS to talk about, so we talked to Boston about the marathon bombing, we talked to Connecticut about Sandy Hook, to say, what worked? Where did you screw up? Where did we screw up? You know, what would we do again? What wouldn't we do again? And a lot of it was about, are we ready? Are we really ready? And to think through, your state, like my state, New York, is very different, right? You know, the west of South Dakota is different from the east, is different from the south, is different from the north. The demographics are different, the topography is different, the geography is different, the people are different, the sovereignty issues are different. So how do you think through what works for you and your community, and who do you need at the table in order to do that? So these are tip sheets that we have. We have lots of publications. We have these town halls, which I invite you to. They're quarterly. There's also an app that can be downloaded on your phone for free, and it provides psychological and behavioral response on the app for victims and others who want something that they can hold in their hand. Anyone that's been involved in victimization, this would be appropriate for. So we do these podcasts. If your community is affected, we will send out one of these to everybody to say, here's what, you know, we think you need to know. And you know, somebody asked me yesterday, well, what is a mass violence event? And it has different definitions depending on who you ask. Different agencies have different definitions. Our definition is, it's not sort of, we're not permitted under our cooperative agreement to respond to any shooting because we don't have the resources to do that. So it's where a community is targeted. And we don't have a number of victims. So, for example, when there was a shooting at the football, who was it, St. Louis, the Travis, what's Taylor Swift's boyfriend's team? The Chiefs, thank you. I know, I'm a little embarrassed I just said that, but, because I'm not on social media or anything. But the Chiefs, the shooting at the parade after the Super Bowl, one person was killed and multiple were injured. That would not normally be us, but we communicated with OVC and they said, yes, go. You can work with that community. So it kind of depends. And, reach out to us. We are always there to answer questions, if nothing else, and then to be there for you if you think that we would be a good resource. So, any questions? Lunch looks like it's out. Oh, here she comes. Well, I want to thank you again. It's just, I will tell you from my experience, you can never over-prepare for this. You will not be sorry if you have a plan in place, and talk to the people in your community, your law enforcement, your Office of Emergency Managers, your, whoever, your elected officials, anybody that you think should be involved in any kind of response. It's never too early to start preparing for this, and you will be glad that you did. So thanks very much.